the subject that we're going to tackle today is really about thinking about what type of exercise would be more relevant when someone is experiencing depression, apathy, and anxiety, which all goes into this bag called mood. And the way we like to run this program is to think about, so if I had 30 seconds to tell someone something meaningful about this topic, this question that we placed, what would that be? The first thing that I want to share with you is any exercise that improves your mood will likely be the best exercise. Exercise is consistently known for improving mood, but obviously it will work better if you are enjoying, if it's sustainable. But we do know that the best evidence for mood is really mind and body and resistance training. These are the ones that have the strongest evidence. And aerobic exercise seems to be the most effective for depression. We do want to also highlight that be vigilant about triggers that may occur during exercise that might frustrate a person and really interfere with the motivation. And just the last thought is thinking about when I do have moments where I'm more depressed or more anxious, what is my backup plan? So with these key messages, we're going to start our talk focusing on first putting into context. What exactly are we talking about? What is this? Where do these symptoms show up? How does this come into the world of Parkinson? Very briefly, we'll waste about 10 minutes in that. And then we'll dive directly into brainstorming about, okay, so what type of how does exercise also play here and how does it help us? These are the three primary changes that are enter into neuropsychiatric changes that may occur in Parkinson. When we think about depression, it's usually associated to this feeling of feeling low. So it's low mood, where we are sad, where we might be hopeless or unable to enjoy things. So this would be a very brief description of how we would define depressed mood. And with this an impact on our social interactions. So we don't feel like getting out of bed. We really don't feel like going to. We might actually go and then enjoy it, but we really don't feel like like going. When we think about anxiety, these situations are more reported like I'm feeling nervous, I'm feeling worried, I'm frightened. Most of the time, people, I don't even know why I feel like this, because you might not find a motive for it that is obvious, but people tend to share with me. Usually it's more in the morning, like I'm waking up in the morning and I'm feeling anxious and I don't really know why. And this is where Parkinson is manifesting itself, especially in recent diagnosis. So like imagine in the first 3 to 5 years, we know that the non-motor issues, which is this, depression, anxiety, they can be more significant, impacting the person's daily life, right? And this is where anxiety might be an example of in the morning, the person doesn't really know why she's feeling like that. And as the day goes by, the person feels better. Now, apathy, I tend to say, is the most challenging of them all, because this is a feeling of feeling indifferent to doing anything. So there is a very intense lack of initiative. And this means that throughout the day, the person is maintaining more or less the same pattern of just not wanting to do things, or even when you are doing something that you really enjoy, you're not manifesting that. And let us think about, so these are feelings and expressions that people might feel, even if you don't have Parkinson. You all agree? So one of the key questions that usually people ask is, how do I know the difference between, feeling sad or being depressed, different from it related to Parkinson or not? So one of the ways that you can, I would say, monitor this is the following, is thinking about, does it persist longer than one day? So we all have, I would say, the right to feel sad. I mean, the world is pretty challenging at this moment. So if all we need is to go look at the news, and I'm sure that we all will become all three, depressed, anxious at the same time, and probably end up with the solution of apathy. But this cannot, if it lasts longer than a day, then it is considered already a red flag. Another criteria, which obviously combined together, is it will have a direct impact on you doing your daily activities, your routines. or even engaging in people that you usually engage with. This is how we distinguish. So this is a message that I would like to convey to you so that it will help you monitor in how can I know if this is an issue and when and where can I look for help, which we'll discuss next. So in this case, depending on the extent and the severity that it interferes with your daily functioning, with your motivation and engagement in social interactions, then you know that we have something that we have to deal with. I do want to highlight that usually these symptoms are mostly reported and I would say lived with more impact with the care partners and the families, specifically apathy. I tend to have, I would say, lots of care to tell the care partners and families that the person with apathy is not suffering as much as someone with depression. Of course, they know that they don't feel themselves, but they are indifferent. Remember, that's the whole definition of the word apathy. But for the family, they go over and they will have so many, they're thinking of so many initiatives. How can I help the person interact or at least smile a bit or talk with the grandkids? And so it becomes something that I tremendously have to constantly be reminding the family that please don't interpret that as the person suffering. These are always sensitive topics because people know their own relationships. They know how the person was. And maybe these symptoms, when they impact the relationship, it becomes harder for people to acquire these tips that everyone else seems to give, right? So I want to share with you, this is for many of you that answered the questionnaire. Thank you for that. I want to just share with anyone else that did not. What we do is we send out a survey where we will already be identifying where people are in terms of certain complaints relating to this topic. And then we bring it to you. So that means that the people that are here have answered a questionnaire. We had 44 replies, which is amazing. Thank you so much, because I think it enriches your voice and it enriches the people that we are talking to now. And with this, we launched you a question, which was, how does the doctor, in this case, this is a question that if you're part of a research study or if the doctor is doing a thorough evaluation, he will ask you, over the past month, have you felt low, sad, hopeless, or unable to enjoy things? So again, you see the definition of what we are thinking of depression. Our responses, what we saw, that most people that I assume that are here with us in our talk today replied that they have episodes of depressed mood that are sustained for more than one day, that are not sustained more than one day, and there's no interference in their ability to carry out normal activities and social interactions. So here are the key issues that we were highlighting before. Okay, so that's good. So what about anxiety? Where was the group relating to anxiety? And again, we also had slight complaints from our group, which means anxious feelings are present, but they're not sustained for more than one day at a time. And there's no interference with the ability of the person to carry out normal activities and social interactions. This is a way for health professionals to identify if there is a problem to intervene on.
And just to be clear, 31% of people responding of that 44 were saying that they're feeling anxious feelings slightly.
Exactly.
Yeah, okay.
And then we have, so what about apathy? Follow the same pattern. We had apathy is quite difficult to assess because we tend to, I wouldn't confuse, it's very similar, it's mixed with depression. And sometimes all these symptoms can coexist at different times, as I said, right? You might wake up more anxious in the morning, but you might have periods of feeling more depressed throughout the day, maybe at the end of the day. So they obviously can coexist. And apathy is difficult sometimes for us to self-assess, for sure. So we do have a significant, so it was probably half of the people said that they didn't consider that there was no apathy. No, so it was normal. So how do we deal with these issues? our focus for the talk is to reach and to think about one specific thing, which is how exercise might help us. But I do want to give you a global picture about how these type of symptoms are managed in Parkinson, right? And so I just summarize this here in the slide, which is when there is a change in your journey with Parkinson, and you feel that something came on either sudden or something's creeping up, it's very important to have these three things in mind. Is thinking about what may be causing this change, right? What is the impact of medication and what makes it worse and what makes it better? This information is very important for you to study, imagine, for 2-3 days, so that when you talk with the health professional, you will be able to help them help you better. Okay. So when you think about these symptoms, it's the same thing. When we asked in the questionnaires, we asked, okay, so how does your Parkinson medication influence depression and anxiety and apathy? So if you imagine you went to the doctor and you're complaining, he's going to be thinking about how does the medication impact? So imagine if I increase the medication in the morning, maybe the person might have less anxiety, right? This is where they need to go in terms of knowledge. And what we see, unfortunately, the medication is not, it's as its strongest. For example, when we compare the effectiveness of medication for rigidity is already considered highly effective versus depression, anxiety, and apathy, right? Especially apathy. There's more for depression. Anxiety continues to challenge. We're not going to go into names of medication specifically because obviously we want to jump quickly to exercise. But this was, so as you can see, it's not clear, right, if that improves, that the medication improves. We only had 9 people answer that it improves. So in a group of 42 people, only 9 people perceive that it improves. And we actually get 1 that felt that it got worse. Okay, so we think about, so what factors could eventually be contributing to these changes? And when we challenged the group to answer us, there were a couple of questions. So one related to fatigue. So I think anyone can relate to the fact that when we are very tired, we become a little bit more irritated, a little bit more depressed. Like, do not bother me now, I need my coffee kind of situation, right? But obviously the one that stood out was fatigue. And being fatigue, another complex symptom in Parkinson that has one of the major impacts in quality of life. When we are tired, it's very difficult for us to be able to do anything, right? Who wants to exercise if you feel completely exhausted? So we have pain that also highlighted here as contributing. So living with pain, again, you can see that these are all symptoms that will overall have an impact on having this feeling of lost, right? Feeling that I'm not having control over the symptoms. And then let's see more that people shared were lack of sleep. Sleep would probably have also an influence on fatigue. Having trouble moving around, walking doesn't make it easier to do stuff as I used to. Right? This would be enough for us to have feelings of sadness because I'm not. One of the sentences that people tell me most is like, I'm not who I used to be. I don't recognize myself, right? So I think that's really the true impact of these type of changes in mood. We see other factors that might be influencing, namely this influence of medication. So when the medication starts wearing off, which is a phenomenon that may happen as you get closer to the moment where you're going to take your medication, maybe the dosage is not enough. And so people might feel, usually it's like motor symptoms, so that it's usually recognized as becoming more rigid or feeling more out of balance. Or eventually, if you're dealing with tremor, a little bit increase of tremor. But if you do have changes in mood, you will feel more anxious. This has only recently been recognized by the scientific community, that we have these non-motor fluctuations as well. So you might feel a little bit more moody or more sad, and you don't really understand why, closer to the medication, right? Oh, okay, let me just see if there's missing one. I'm losing the ability to think things through, need help in remembering my medication. Okay, so we can see lots of things that can contribute to us feeling less happy. And the interventions, one of the options that we have pharmacological interventions and we have non-pharmacological interventions. These are the terminology that's used in medication. So if the person is having this problem, our suggestion is like, try to think about what is causing it, and you need help for that. And you need help means your neurologist is supposed to be the most competent person or central person that you are going to go to and say, I'm dealing with this. What options do I have? You will make that triage. You will help you identify which factors are contributing. Because imagine you're having sleep issues that are contributing to the depression. The depression is causing the cognition. So you see, they can all intertwine. Maybe so
very much. So I would even say that Parkinson's, because a lack of firing of dopamine, means that all the cascading other neurotransmitters are also affected. It's all part of the same issue.
So a specialist will help you try to go back in the cycle and try to understand which is the factor that's causing the problem most.
Or what's the most treatable factor. Yeah, very much so. Medications for depression can be very effective and not so much for apathy, although there are other options, stuff like that.
When we think about non-pharmacological interventions, so obviously the word rehabilitation, and this includes in the world of psychology, cognitive behavioral therapy, which is one of the tools that is already highly recognized as useful and effective for treating depression, and then all other questions of anxiety and mood and apathy as well. Apathy has less studies, so it's always with some effort that we combine it in what exists. Physiotherapy shows up here in terms of exercise, and that's really the point that we get into. So we can do exercise in a very specialized kind of context, or we can do exercise as part of life changes that we do in the community or close to our home. A word for support groups, that we know that obviously the social interaction, as you saw from the definition of how do I distinguish, is me not wanting to be with others. So that means that the support groups that really, someone that really goes to your house, no, I'm missing you when you weren't in class today. That type of interaction makes you feel that you're part of a community, and that is usually very helpful to control or maintain these changes in mood. Reinforcing strategies that people use. If I have someone that comes to the clinic and is very anxious, I will try to focus on, can I have what I call a rescue strategy? Can I distract that person quickly, focusing on something else, so that I can get the person into a better place so that we can do the exercise that we want, right? And the same goes for in the home setting. If we have someone that is very anxious, can we quickly occupy the person's mind or change the focus of attention to something else? The most well-known one is music, obviously. If the person listens to something or goes out for a walk with friends, we need to find those strategies that you can use at any place at any time, because unfortunately these things can happen unpredictably. But these are the key ones that people use. Okay, so hopefully everyone's okay, and we go into our second part where we're trying to think, okay, so how can, truly everyone keeps talking about exercise and how it's so beneficial for so many things, and it's in this current evidence, maybe in the last, 5 years, that we've recognizing more and more the role of exercise, especially for non-motor issues like the depression and anxiety. When we have someone come in, and what we do after, there's ways for us to assess this. So there are, besides those questions that I showed you, that's part of a whole neurologic assessment where we will identify all these symptoms. So it's not only about identifying how rigid you are, how out of balance you are. These tools exist. Professionals have access to them. And the first thing that a professional, when I identify this issue, that has to come to my mind, if I'm using evidence-based practice, is, okay, so what is the best evidence that exists for mood? And this is where I shared with you in the beginning, like, I don't feel that it's strong enough for us to really say something useful. But the truth is, we can't mimic research studies, right, in daily life. More and more we want to have research studies that are about daily life. But the truth, when you think about research studies, it's a very specific context with very specific people. They get a very specific attention as well, right? So if you participate in a research study, you know that people want you to do something. So your motivation is completely different as well. And this to say that we have to be reasonable when we see the studies, and to say, how am I going to apply this to the people that I treat? So one of the studies that just came out recently, so last year, which is quite interesting, is just looking at different types of exercises and what would be most meaningful for depression and for anxiety. And I'm summarizing it really here because I want to give you more practical examples. And in the study, they came to the conclusion that aerobic exercise, which means your heart rate is increasing. We have so many examples of that. We have cycling, we have walking, we have boxing, we have dancing. And then mind body, here we're talking about Tai Chi, Qigong, yoga, anything that combines mindfulness and meditating as well. So a more emotional kind of experience. And then resistance exercises, which include strength training exercises. These were considered most effective for depression. So now I'm guessing everyone's thinking, what am I doing? And what the exercise that I'm doing, does it contemplate this? And I can tell you that most exercise programs, especially when they specific for Parkinson, they will probably have a component of each one of them. Of course, the mind and body exercises require certain environments. So maybe the component is not so easy to include in a boxing class. For example, we have the stretching, we have the aerobic component, we have the strength, and maybe the mind body in boxing is actually not present. But I must tell you, I've had people that are very anxious that have shared with me that yoga or things that relax them, they've tried it, and nothing relaxes them more as the boxing, for example. So here comes into play a lot of how the person really is able to relax. It can be different for each person, right? Okay, so for anxiety, we have, as you can see, it crosses over. So mind, body, and resistance exercises are beneficial both for anxiety and depression. We do want to highlight here that what part of the study was also seen that aerobic exercise in particular was effective for depression. Okay, so we scanning the research, this is the evidence that we have. And then you can have different types because they look at different studies, right? So you can have different ranges, 2 to 5 sessions per week. According to the guidelines, we have a recommendation of people doing aerobic exercise 3 times a week. But now imagine I'm really dealing with this depression. I really want to focus on something aerobic. Why not increase more, right? According to this study. A specific example of aerobic exercise is obviously dance, and it has been subject to a lot of research. It's one of the exercise modalities that most research has. And I did want to bring you two studies that you see, and I could bring you much more about showing the emotional and the social effects, so the perceived benefits that people feel in these areas using dance. Now, people can say, but I don't like to dance. And this is where I think the strongest thing here too is the music actually, and the music linking to the person and being able to do movements. So I don't think we all have to learn how to salsa, right? But appreciating music and movement usually it facilitates in Parkinson. And particularly in situations with apathy, I must say by experience, it is usually one of the few things that really works, is putting on a song that the person really likes. It can be opera, it can be whatever. And being able to just empower the person to feel the music and then just start moving according to his capacity or her capacity. I'm just going to give you 2 more examples of research studies, and then we go into practical questions. This is just reinforcing the use of yoga, in this case, mindful yoga, which mindfulness yoga. So it must be a combination of more meditation. And basically what they did was compare with stretching and with the resistance training and trying to assess if it had additional benefit over anxiety and depression. And they confirmed that there was a tendency for an additional benefit on those. Now, another question we think about, okay, so what about the context? We know that the personality will influence. How about if we compare home exercise with individual therapy, with group classes? Where could we get the most benefit for different outcomes. So for this talk specifically, I want to highlight that obviously we always associate group classes as having ongoing motivation. So it is the context where people get most motivated. But we got strong suggestion in the study that it is the home exercises were actually the place where it was more challenging and had the worst results in terms specifically for someone that is dealing with depression and apathy, anxiety. One of the reasons I always say I want to take people out of their home, right? What another outcome of the study was quite interesting because they compared the people that had supervision. So that means that someone that had a supervision, either physiotherapist, I'm imagining it doesn't have to be a physiotherapist when I translate this to our daily lives. It's about having that person that pushes you, right? That's there with you, had the best results. Research often confirms what we already have the feeling in practice. So just reinforcing this because there were some questions about if I do exercise alone or what would be the difference. And this was actually a comment from someone from the surveys that when we asked what makes it better, the mood, and I found it curious that the person would answer, oh, well, it's when my physiotherapist comes once a week.
Is that before you were coming 3 times a week and now you're telling me only once a week? Or
yeah, well, could be interpreted that way. So obviously I'm not reinforcing here the role of a physiotherapist. This is what the gentleman wrote, but it's about having someone that really helps you in this context. So in home settings. And I did want to give you an example. When we think about exercise prescription, we think about when a person says, what is the best exercise? I usually say, tell me what you want to improve. And then I can answer better this question. Right. So if you want to improve your gait, I will give you a suggestion of gait exercises ideally. Right. But if I identify that you are dealing with situation of depression, that you are and motivation, I will probably not respond immediately. And I will be asking you, what do you already do? So I will have a different approach to try to understand that probably the most important thing will be anything that the person can do. Because the lack of initiative means that this is the only exception that I create when I'm thinking about prescribing exercise is if we are dealing with situations with mood changes, then anything is valid. And I want to give you an example of the craziest exercises that sometimes we invent. Okay, so you should be seeing, even if it's nice and slow,
a pillow fight.
Some people asked in the questionnaire for ideas, and that's what I'm sharing with you. How many of you have had a pillow fight in the recently years? I must tell you, it's very aerobic. It's super fun. I hope this is legal in your country, but we are just slightly playfully touching the person, obviously, and I'm training balance. My focus on this gentleman is keeping him active, keeping him motivated, but my physical goal is improving his balance. We can find different ways to do that.
I'm not sure if you're going to see a lot of physiotherapists assisted pillow fighting, but you are guarding him very carefully. So that's the main thing right there.
Yes,
so.
we can be sitting down.
Yeah.
I'm just leaving you ideas, especially if there's family members that are present that would like to challenge. I know how difficult, especially apathy is, and you should try this one.
This is with foam rollers or something like that too. Yeah, something you see.
No, nothing like a pillow. So I want to now just ground us on there's 2 ways I look at this. So we can either adapt what the evidence is telling us. So as you saw, we saw mind, body. Okay, so I'm going to grab onto Tai Chi and I'm going to try to apply it to people that might be dealing more with anxiety. Okay, that's fine. I probably have to think about the time. There's other issues that we have to think about when we think about adapting exercises, and we will touch upon examples on that. Just so that it makes sense now. The scheduling, the flexibility of being able to book the sessions at hours that the person might be more reactive. The person is very anxious in the morning. I'm not going to book a session at 9 o'clock in the morning. I'm going to ask him, when do you feel better? And can we have a moment then? Right? So this type of, when I say adapting what exists and what the evidence is showing us. And then obviously we can be more creative. And this is a challenge more for the health professionals, and you are here today, and maybe you can challenge your health professionals also to think out of the box. And I'm going to give you an example of a very weird exercise. First, I'll show it and then I'll explain it. Okay, so you don't think that I'm a crazy woman. I will explain now that Idelto, who actually is on the call with us, yeah, you can intervene and validate what I'm saying. She came that day, and we've worked for many years. I know her already a lot, quite well. And she said she was really angry with her husband. And she said, I really just feel like hitting someone, right? And that was a cue. It was like, how do I create quickly? She was really irritated. It's like, how do I create a distracting exercise that will somewhat be meaningful to her, because I'm recognizing that she's irritated, and we are just grabbing onto something which looks quite aggressive, but it's not, because we do boxing as well, right? So which means we are just using the sounds of slaps and just slapping.
I have an app, and I'm cameraman on this one. I'm hitting the button on the app, and they're it's kind of crazy. It's really funny, actually.
So I want you to keep in mind that if you are really dealing with these issues, you know that this would make sense in terms of despair of creating something where we make the person react, right? It is quite challenging to create new exercises constantly, especially when you're dealing with people with depression and anxiety. It is very important. That's how we adapt exercise world, is by creating constantly something that really means to the person. Okay, so it's suggesting, I hope I've explained it well so you don't think that I'm an aggressive therapist. It's for this, but we laughed so much. It was so much fun that the video just doesn't really show that justice. Okay, so let's think about what are these challenges when we think about exercise. So if I have to adapt something that I'm doing, what is stuff that I want to look out for? And when we have someone come in, there's so many questions that go into our mind. And I want to share that rationale with you so that you understand that sometimes people might hesitate to give you a direct answer. Like, so what's the best exercise? We hesitate because of this. First question that comes to mind: what form of exercise is the person that's in front of you most likely to start? And I would even say the next week, right? I've just identified someone that has severe issues with depression and moments of anxiety, and these are all the questions that I'm asking myself. What is the minimum effective dose the person can realistically adhere to? Someone that really doesn't feel like doing exercise, or doesn't even like it, or even if they like it, but they have no initiative and do not want to do it or feel the relevance of it. How do we find the less that can give us the maximum results, right? Well, should I just automatically say, you know what, you need social support, you need groups, and then just launch the person to a list of group sessions? No, because there's a question that has to occur. Will group-based exercise trigger social comparisons? So if the person is very anxious, worried about progression of the disease, and goes into a group setting and is not prepared to see people with other difficulties, this will backfire. You all agree? On the other hand, we do know that the best evidence for, dealing with depression is social interaction, right? So that means that eventually the person might have some interaction, might grow a much needed connection with someone, or hopefully the whole group, right? We can't pretend that people will just become friends just because they have Parkinson, right? You have to find that person that really connects with you, that you can have a conversation that you identify yourself with. So making groups is not as easy as it seems. Other questions. Do I need to choose an exercise that will provide immediate mood benefits to encourage participating now, and also to encourage the person to come back, right? So if the person has a good experience, they might, okay, I'll give this another chance, right? Or did I explain it well enough in terms of benefit of exercise that I know that I need at least a month for the person to be able to perceive any benefits of basic exercise, right? So it's like if I need to urgently make it fun so the person can see that we can do exercise in a fun way and then it's actually entertaining, let's call it that. We need to entertain. Then I go one way or I go the other. Let's think about, I'll finish your question.
Sure.
How about, does the person experience fear of failure? This is very present usually in anxiety specifically. Or have they had a negative experience in the past that would compromise completely their adherence in whatever program that I am suggesting, right? Anxiety and fear of failure is usually related to the fear of progression of the disease, specifically in Parkinson, the fear of symptoms, of not being able to control the symptoms. And so that in specifically for exercise is there is a group of people that really believe if I don't do this exercise perfectly, then I really don't get the benefit and then my disease will progress. And if I'm doing an exercise like you just saw, which you look at it and you think this makes no sense, I have to first be able to triage that the person in front of me is not someone that is a perfectionist. I have to calmly explain to the person the most important thing is that you are able to do and participate actively and engaged in an activity more than you getting that perfect amplitude that, by the way, you will never use in daily life, right? I tend to be more flexible because I deal with a lot of people with depression. So I'm not that rigorous in professional convictions. So we have one last question, if I'm not mistaken, which is, does the person need structure or predictability? So something that is fixed, routines. So I would say by experience, sometimes when I have people that are over 80 specifically, they really like an organized structure. So something that they will do daily, and that's okay. Even if I don't enjoy it, it's something that I can deal with. It's comfort zone. Or do I have someone that, because of apathy specifically, needs to be constantly changing the type of exercises? Two different approaches, as you can see. That will probably happen if the person is younger as well. And I'm finishing with, does it fit the person's identity? So imagine you are someone that really likes mindfulness, you like yoga, you like something more calm, and then suddenly someone's telling you, you know what? But the best exercise in Parkinson is boxing. I'm sure that you will probably hesitate, and vice versa, right? If you are someone that is more active and you like more vigorous exercise, and then suddenly someone's telling you, no, the way for you to approach your anxiety is to go and do yoga or just simple mindfulness. It can be quite challenging for the person to identify themselves with this. Okay.
There was a great question here. This seems to be the right place where what about the benefits of massage? Have you ever had anything exercise-wise or study-wise?
If we think about mood, I think it's a nice boost for mood.
Sure.
Who doesn't feel good after a good massage?
Yep.
I would say it would be wonderful if everyone could just have a whole body massage every time you go to bed at night. And I'm sure everyone will have a better night. They will wake up better in the morning. The truth is, when we think about how do we fit this into therapy, if you do have access to it, it brings benefit over feeling good, physically good. And obviously physically good means emotionally good. So I think it has a high ranking for maybe not supported by evidence, but for sure, I'm telling you by experience, it's worth doing.
Yeah, probably not a bad thing.
But if imagine you had to choose, I'm going to do a massage or I'm going to do yoga. In that case, I would have to say, you know what? Yoga will probably have longer lasting results. If you can have both, that's ideal. But if you have to choose between one and the other, you have to always think about how long does it last and how does it really impact my disease. And if you really have a bad day, I think I'd go for the massage and fight with the yoga next week, right?
Yeah.
Remember, the flexibility in these situations particularly is very important. Okay, so because we are in a world at this moment where people are already doing a lot of exercise, which is wonderful to see, as I often share, when I started working in Parkinson, people did not do exercise. It was considered not necessary. And so we live in a different world right now. And so one of the questions that we did in the survey was to really ask you, okay, so what are you doing? And I think this is at this moment an important question to always add in. What are people already doing, or something that they did in the past that they really liked? Imagine like football or something, or it has to be something in your blood, right? That you usually do. Baseball, in your case.
Sure.
When we ask this question, of all the exercise modalities that you do, which one would the person consider that improves their mood the most? So coming from our survey, the more responses came out for walking, which I think is a very valuable recommendation, because even in the clinic, sometimes people might become more anxious with an exercise that we're doing. Say, oh, let's just walk it off. It's an expression we use often. Let's just go outside a bit. So it's a way to change focus. So definitely walking would be one of the exercises that enters into aerobic exercise. And there's additional benefits shown for walking in nature. So there's additional benefits if you walk in nature for mood purpose. We have some people sharing, you're walking with my husband and sharing few in-depth videos. I found this one interesting on topics of interest to me and my husband, and discussing these videos with him. Now, I want to give an example to the group here. If I grabbed onto this comment outside of the context of depression and anxiety and apathy, I would probably tell the person like this. Just be mindful that when you are talking with someone and walking, your walking pattern might be changed. So you might walk slower, you might shuffle your feet more. We know that there's an influence over doing an additional task when we're walking. And this is a distracting strategy that the person is using. So it's super valid, because in this context of motivating someone to do the walking, it is more important to keep the person motivated than worrying about shuffling a little bit of the feet. Do you see how this has to be balanced? And I always say, at the end of the day, good sense. We wish everything could be perfect, but it's not. So it's, if the person is shuffling a little bit their feet and they actually slower because I'm engaging in a conversation, I'm actually questioning, but that helps the person want to go and walk, then super valid. This is a good strategy.
Someone in there has walkies, which used to be able to take our dogs out. We go, walk.
Oh, I did not know.
I don't know if that's true or not.
Okay, other things that people shared was some activities that they did in class-based activities, so those social and peer support groups. So we had someone that talked about chair fit, because it's early in the day. It improves my expectations for the rest of the day, so it has a nice impact starting on the day. And it's a group activity. It would be hard to do on my own, okay? We have group sessions, all sorts. So in-person, Zoom, group classes at the YMCA. Again, we have a variety. I don't see anything that would be pickleball, of course, is becoming very popular, a very interactive, engaging sport as well. Dance always showing up for sure, and water aerobics. Probably more challenging to talk inside water, but yes, for sure, definitely a good reference.
That's social.
It doesn't feel better after water aerobics. Other things that people shared, so would be home exercises as well. We know that people need different options, because rainy day, I'm unable to go, I'm bothering, or I'm bringing more trouble to my family every time they have to take me somewhere. So I think home exercises is always a good option. So someone used the example of doing some outdoor repairs. And I find this very curious, because I have several people that tell me, when I'm doing something I really like, you mentioned taking care of flowers, or, in this case, repairing the car or something, it's like I don't have Parkinson. So it's activities that take you away from your disease, and that it's moments that you really enjoy, right? We hope that exercise would have the same effect. So we have bicycle, just going through it quickly. Zoom are good options for the home. So you don't, I think there has been some comparison about me watching a video versus me actually participating in a live Zoom class. The person feels more engaged when it's live. But of course, the timing is dependent on when the class is booked, right? So it's always back to how you can fit this into your day. And the last things that people shared were also, this is where I took that quote from the gentleman, when my physiotherapist comes once a week, or when my wife exercises with me. Other things that motivate me is basically when there's music in the background. I like this shit. This.
Big one.
It's very, I think when you're in a gym and you don't have music, there's like a piece missing for sure. And then obviously sometimes it's difficult for us to understand what really helps us. So it's normal that people will feel challenged, but hopefully by reflecting on it and having all those questions, that it took you to a different place about how can I look at this in a different way. When you asked about, what do you think the effect is of exercise on your mood? If you think about after an exercise moment, most people said they had a strong positive effect, right? So things like it boosts my mood. I feel good when I'm exercising. It makes me feel better. Joy, self-esteem energizes me. So I think we can all relate to this. I would always say that I think exercise should. I'm trying to think about a moment of exercise where the person gets out of there and is in a bad mood. It's like something really has to go wrong in that session for that to happen. But if anyone has any experience with that, please do tell me, because I'm curious about what would be a bad experience that the person would get out of there in a bad mood. And I think that usually relates to frustration, and that identifying triggers during exercise, things that might make you feel more anxious, maybe. Like I imagine you are in a busy gym and you feel that you're having some difficulties with balance, and then you're having all these circuit trainings where you have to go from one place to another, and it suddenly becomes a lot of cognitively challenged, because it's a lot of things to deal with: the noise, doing it right, knowing where to go, and that can eventually be one factor.
Yeah, high visibility too when you're in gym like that.
Okay, so going on to sharing with you, let's just say the study that we did with everyone that responded, what discourages you most from exercise. As you can see, the number one cause is fatigue. As we mentioned before, it's quite challenging. Fatigue will be present in terms of Parkinson, especially when you feel that the medication might not be working at its best. It's when some people report, I don't have strength, because you use different words to describe the inactivity, the difficulty to move, right? But hopefully, with adjustments of medication, then also is manageable. Please don't lose hope that it's everything that's here is probably possible to manage. And especially when people use the word here, laziness, this is something that when we are it's more harsh to ourselves, more unkind to ourselves, because if you go to these talks and you see about all the symptoms that can impact people with Parkinson, you have the motor symptoms, you have the non-motor, you have the complications of the medication, and you still have the complications of the disease. It's a lot of things. I think I tend to be kinder in this, in not saying the person's lazy. It's the difficulty to have the initiative that sometimes might be misinterpreted, especially sometimes by care partners, by families, that might interpret wrongly apathy, and the person doesn't want to do it. But it is a word that I also hear from people, right? So it's how we talk to ourselves. And with all this, I just want to say, rethink, fight against that laziness, but it might not be laziness. Can we think of things that we can do to the exercises that we are doing at this moment? So sometimes things that we are doing that will improve the way I am able to perform better in my exercise and fight better against these fluctuations in my mood, right? So the number one that was highlighted was 60% of the group. This chose music as the number one way for me to adapt the exercise. So if I, especially if you use music that you really, really enjoy, it's very empowering. In second place came fun and challenging enjoyment and gamification, which I'm very happy to see that is something that people are looking for. Even today, I had someone says, I just get bored with it. I think it's an exercise professional that goes there, and it goes to his home, and he says because he's always doing the same thing, and this bringing variety and making things fun is so important. And we just have to challenge more the people we work with. Then we had doing it at home, online, or with the professionals. So that means comfort. You can imagine that if I'm someone that's very depressed and doesn't want to go out, maybe I can challenge myself or get myself to actually go on to a Zoom class. And that's okay because I can, switch off the camera. I can go away maybe half an hour, or I do 10 minutes and I can just leave. So it's kind of more flexible. Exercising with the groups and community is not novelty to us, but it did not come out as number one, right? We all would instantly say you have to be with people, but getting people with people is not as easy as it seems. So exercising with a care partner, and we can see all the different clear goals. Some people are driven by monitoring themselves with the tech and to see how many steps that I take today. And that's already been researched. There's a way for people to keep motivated as well. I do like this idea of shorter sessions so people don't feel that, oh my goodness, I'm going to go to my boxing class and it's 1 hour and a half and I'm not going to be able to be there the whole time, or the fatigue. So it scares people. So having that flexibility inside the classes, talking with the people that you're working with, to say, sometimes I might just need to just take 10 minutes. Just give me 10 minutes. I had a situation happen today, someone with severe apathy. And as I got to the home and I'm coming in all cheerful, we'd say, the cheerleader coming in. And he just says, let's go with ease, with calm. And he's smiling, but he's telling me, you know what?
Tranquilo. I
just got out of bed. I'm trying to, get into my day. It's almost, I can respect that because it's the effect of coffee, right? So, and I'll say, I'm taking it easy. I'm taking it easy. And then I just decided to shut up for 5 minutes. So I just kept quiet for 5 minutes. And I put on the music. And it's a music that he likes. And then he started moving by himself. So initiative. And the rest of the session went brilliant, right? So, but if I come in and I just, no, we have to work, let's go, blah, 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 that probably would have not worked so well. Okay, so just pushing forward. In key messages, I just want to give you examples of things that people are already doing in the community. So dancing and boxing. And you think, is this enough? And I can tell you that dance and boxing are something that is used in therapy as well, right? So it's we can reinforce the movements that we want using these type of interventions. So don't feel that, okay, I might be failing at something. If this is something that you enjoy, these are very great examples of aerobic exercise that can be adapted. Keep in mind that I think something easy that people can access is also online classes. And you might see me doing very quick movements here and think, that's crazy because if it's supposed to be more mindfulness in yoga. The truth is, even when the person is very depressed, empowering music really stimulates a lot. So if I do movements that are very slow, the person will do movements that are slow. If I am really engaged and pushing for the person will push more. So that means the aerobic component will be stronger, and that means the changes in mood are more likely to be different at the end of the class. Okay, so that's where we go when we push a little bit more. And you can see you have all sorts of people, obviously, in class that can participate and adapt. I think that the secret is really feeling part of something. And so if you, no matter what class you go to, is feeling that you are seen, I think would be the key word. And that means the professionals have to do that work where they are there with you, right? And I want to also transmit that, trust that your professionals can adapt and they will want to. So give them ideas, show them talks, show them videos. It's nothing works better than a ball, I must say. If you are trying to motivate someone to do exercise, even in severe situations of apathy. All the situations I'm showing you are quite challenging, and you can find just different ways. This is simple, just having a basketball net, and I'm just training specific things of the gentleman turning around. Sometimes I can ask really impossible things. People align because they feel the challenge. In situation here, this third situation is someone that usually is fluctuates about some motivation as well, and I think that we use of like and he's actually doing a combination of cognitive exercise and also using something that he likes a lot, which is the boxing. And here is just a message about sometimes adding cognition and turns it into a game. And so even if the person has a lot of physical difficulties, if we transform it into a game, we are more likely to keep the person more engaged in the activity. Okay. And that's the tip. And okay, let me just be mindful of time. It's often that I hear that people say physiotherapy is not fun, and so just a point that it can be fun. Just guide your therapist in it. I'm sure people are more open to it right now than they were before. The clinical role plays against us here. So if we are too clinical, like you see most of the videos here, I'm not using uniform at all. It just makes try to get into the world of the person. In this case, it looks like I'm doing something weird. But the gentleman really hates exercise. He suffers from severe apathy. To get the gentleman to do anything at all, I'm playing that he's canoeing, and as he's doing the exercise, I'm actually splashing water at him, and that's okay in my country, right? So I'm just playfully, obviously, just engaging with the gentleman, and he's saying, I think people will look at this and think that you are mistreating me, and he says, and I totally agree with them. So the gentleman is 89 years old. This is super humorous, and he had so much fun. And you know what? So did I. And so if it's fun for both, I'm sure it works. Another strategy that maybe you might want to think about is what I call secret missions. So usually I'm asking someone else to help someone else. So if I do have a group and I know two people that identify themselves in terms of personality and profile, I might ask one to help another. So here you have two people, a delta and Joao. They are playfully, just in a boxing class. And one suffers from severe changes in terms of depression and the other one from anxiety. And so when I say, can you help this person control the anxiety? And can you help me motivate the other person? So it's, I call it a secret mission, but people, they know they're helping each other. And that's usually a motivation to exercise. And it's a motivation to come to class as well. And here the same thing. It's the same gentleman that doesn't really like to exercise and said, well, could you help me make a video so that I can show others how we sit and stand at home? And it says, okay, but just for that, we have to just be a little bit creative in the things. I did want to touch on quickly on adaptations maybe for care partners. We did ask in the survey, what would help. And so just some strategy that you can read through then with the slides, but just the encouragement. How do we help? How do we control helping too much? When does it become a problem? When does it become a nagging issue? Because I get two sides of the story. I will hear the family member say the person he has no initiative, he takes too long, he doesn't do anything. And then on the other hand, I have the person in the Germany says, my wife is just getting so irritated all the time for no good reason. I did not realize the time had passed. So we try to manage this by helping people understand that, taking long is part of the disease, is part of the depression. Organizing your thoughts when you are depressed, it could have impact on cognition as well. So that's one of the concerns. One of the ways to reduce this is let's exercise together. So let's create programs where people are exercising together so they learn how to work together, right? These were some things that people with Parkinson shared when they exercise with their families, the benefits. So it makes it more disciplined, more motivation. The social interaction is good. So it makes the relationship stronger. So it's nice to see that this recognition, right? So people understand there's a benefit. But I just want to highlight, and this will be on my final port here, which is it's important to reinforce that people should exercise as buddies and not as someone correcting, because often we invite the families to participate or either even in the one-on-one or even in the groups, and to stimulate this, which is if we are constantly correcting the person we're trying to help for exercise, it's very dismotivating. And then you think, wait a minute, but we want the person to do it well. If you are dealing with someone that is at risk of not wanting to do exercise and is feeling really sad and doesn't have initiative, if we are overcorrecting, it won't be helpful. So you'll lose that battle. So finding ways to both are interacting in activity, and we are here to at least get some aerobic exercise. That would be fun. This is a simple idea, again, based on what people asked for ideas. Let me conclude with reinforcing that obviously exercise improves mood best if it's enjoyable. This is almost obvious, right? If it is social and if it is sustainable. So we must connect with people. That means we must be able to be there for as long as possible. So if I have imagine a group class that's 2 hours away, the probability of me continue going to that class is very reduced, right? So keeping that peer support means that I'm able to keep it entire. Another key message would be that exercise should constantly improve mood. By definition, it's supposed to have that. So if something is making your mood worse when you are exercising or after exercising, it's probably best to get reassessed and try to understand what's going on. That shouldn't be that effect.
Even if it's just an exercise that's too challenging or something, get it reassessed.
They're not supposed to get out of there frustrated with something.
Shouldn't be like rush hour traffic or something.
Yeah. And then just to conclude that obviously the best exercise is the one that a person can do regularly with confidence and with a good experience, with a good emotional experience, right? And that is effective for their problem. It reinforces what I said earlier. If you are dealing with gait problems, you might want to do exercises that have the best evidence for gait. If you are dealing with mood issues, you probably want to do any exercise that will help you improve your mood. So this is the only exception that I would create for against personalized programs or in favor.
Sure.
Which is we really need to find ideas to keep people motivated.
Yeah, and the personalization is a motivation.
Yeah.
That's what you're doing that for.
Hope the information was useful. I wish there were better answers, but please do reach out to us if you're dealing with something specific. I'm always happy to brainstorm on ideas.
Yeah. Exactly. We'll prepare all the slides and the video will be edited, and you will all get an email directly from me letting you know that it's ready and it'll be available. So it usually takes a couple of days to edit, especially with all Josefa's video because she's got a million of them in there. So be a minute.
I hope you don't feel that I'm an aggressive person, but I do think boxing is such it works always. It's the dancing and the boxing. They always work.
Having the sound effects.
When someone is going through a tough time, it's just like you put on some gloves and like pum pum, pum pum, and then they pum 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 pum, stop bothering me, and they stop reacting.
Your great job today. Appreciate it.
Thanks, Ralph.
Yep, great job as always. Thanks, you guys.
Luke, take care. Thank you, guys. Thank you, everyone.